with Dr. Gillian Hotz, who is the director of the Kids Neuroscience Center. She's a research professor in the Department of Neurosurgery and head of the concussion program at the University of Miami. A very dedicated woman I've gotten to meet over the last few minutes. It's my privilege to introduce Dr. Gillian Hotz.
Okay, so I actually wear a lot of hats, and I'm a very busy person. But I move really quick, and I talk really quick. So I can get a lot done in a day. And I've been involved with taking care of children with severe, moderate, mild, all comers since 2000. And I really have grown to appreciate the word neuroplasticity. And, you know, now, because the years I've spent looking at all these kids, let's all remember that 80% of brain injury is mild. Okay. So we're really seeing the ones that get admitted for the most part and have the longer stays as more of the severe and moderate ones. But what has taken hold of our newspapers and ESPN, and as Dr. Gupta just said, the media, is this concussion frenzy. And I call it the concussion craziness. So every day you see something in the newspaper, or you hear a report from the DOD or Walter Reed, or hear about blast injuries and young girls, soccer players having higher incidents of concussion, car accidents, and of course in this country, football. And where I'm from, Toronto, we talk a lot more about hockey. So I was on the plane going to a neuroscience meeting, and this article is front and center in the New York Times. Would I let my son play football? Okay, I run a busy concussion clinic. I have a clinic during football season with a wonderful neurologist, Kester Ned. We've been working together since 1995 in this clinic. And there isn't a clinic that doesn't go by where a parent will ask us, should I let my son, daughter, go back and play X, Y, and Z? It's usually soccer or football. And then I had the opportunity of interviewing Dr. Julian Bales. So Dr. Julian Bales is a neurosurgeon in Chicago, and he also is the medical director of Pop Warner in this country, which Pop Warner has the biggest youth football league, has the most number of kids that play across this country. And they changed their policy, they changed their rules, shorter practice time, better techniques. Coaches and trainers, if they have them, need to have some sort of education or certification. And how do we play this game safer? So heads up, lead with your shoulder, and sort of, taking the whole contact head-to-head sequelae away. And he does let his kids play football. And then I also have the ability to talk to a lot of ex-NFL football players, being at the University of Miami and also being with the Hurricanes. And most of these guys say that absolutely they know what they're getting into, they're signing up for duty, and they would let their children continue to play football with all the information that's coming out. So I'm sort of in a bit of I'm sitting on a fence now because I still aren't too sure about what all the evidence is showing us. And then, on the other hand, we're seeing all the CTE information that Dr. Gupta was telling you about today. So then I said, okay, let's look back at history, because you always have to learn from the past. So in 1905, that's when Roosevelt was president, his son played for Harvard, and in that year, there was about 18 guys that died in a football game. And so he decided quietly, there's no cell phones, Twitter, or anything like that, he decides to have a quiet summit at the White House. And he called together all these wonderful people, and he said, what are we going to do about football? And this is in 1905. And they decided that they're going to make the game safer. So how did they make the game safer? Well, they put on these leather helmets, they changed the yardage from 5 to 10, they started this forward pass business, they instituted a line of scrimmage. So at that time in 1905, they made the game safer. Okay. So then we come about 100 years later, and has anybody read The Tipping Point in this room? No, I'm glad. Okay, Canadian guy. Anyway, So he talks about things that like sort of, keep gaining momentum, rolling stone, and finally, you get to a point where everybody's talking about this thing, and now you can't sweep it under the rug anymore, and it's going to stay out there. So now we've been talking about concussion in football and sports for a lot of years, but not until our friends at the NFL decided that there's going to be a multi-billion-dollar lawsuit that we all said, okay, well, wait a minute, if this is what's happening at that level, let's all start wondering about what's happening when these kids start playing pop and then youth and high school, and by the time they get to college, what do their brains really look like? But this is a Band-Aid, so let's not kid ourselves, okay? This is just, so this thing would just go away, and we're not going to delve into sort of the dirty laundry that all these files seem to have. And so what's really good about this is, as Frank was saying actually in his talk today, that it's about early intervention. So guys like Kevin Turner and some of these other guys out there that have developed ALS and some of these other issues, they can get their money now. So their family's not going to get the money when they're gone. But people like Kevin might have a better quality of life for a little bit longer. And if you get a chance, watch The American Hero. It was done by a friend of mine at HBO, John Frankel, who's been covering a lot of this stuff too. It's a phenomenal film. So, culture change. This is what we've been talking about today. Changing the game, how do we think about behavior change? And so, yeah, like, we're past, like, okay, he's Ding syndrome, he's a little goofy, he's punch drunk. I think we're past all of that now. And so basically, like, where are we at and like how huge is this problem? Well, I think the first gentleman that starts today gave us a few numbers about brain injury in the state of Florida. Well, guess what? Like, most of those don't even get reported if they're a kid that's fallen off the swing, or maybe he is in a football practice or a basketball practice or baseball practice, gets hit on the head, goes home to his mom, has a bit of a headache, and then just goes to school the next day. So our numbers are not reliable, and we have no idea what the real N is in this country. So we all know about the acceleration, deceleration. Dr. Gupta talked all about acceleration, deceleration, rotational, linear. This is a medical diagnosis. Concussion is 850.9. So a lot of you guys that do billing out there or write these in your medical charts, this is a medical diagnosis. So who has to make the diagnosis of a concussion or a mild brain injury? Medical diagnosis? Does that have to be like a physician? So anyway, we talked a little about, and he did already, the mechanism of concussion, the linear, the rotational, and then we go into the individual sports. Okay, so where are we seeing high-risk sports? Of course, we talk about football, hockey, women's soccer, starting to get a lot of press. Why? Because these young girls are asking to head the ball when they're under 14 years old. They don't have the technique, or they don't have the neck musculature. So I just came from a meeting which Dr. Savage just chaired in Navis, in New Orleans, and I got to hear Tom Gennarelli. I haven't heard from Tom Gennarelli since the 1980s when I was in Boston. And he is still talking about diffuse traumatic brain injury, diffuse axonal injury, and they're still talking about the shearing and tearing at the microscopic level, at the brainstem level. And what he reminded us of is, this is all sort of head motion, head distortion, and it's the degree and the velocity that this all happens at the time of. And what I also recalled, and I asked him if I could take a picture of this slide, was that concussion's on the continuum. So we start at the very end of the continuum with no LOC. You don't have to have a LOC to have a concussion. But really, when you start looking at like some of this old work and like where this sort of all originated, we have to remember, let's go back to the definition of a medical diagnosis and concussion being a brain injury. So let's just go back to now understanding that we have a brain injury we're talking about. So CTE, this did a lot for us. This took us right into the world of NFL and repeated concussion, and guys like, Junior Seau and Dave Dewerson having their brains sent to Amickey's lab or other labs, and all this evidence of increased protein, increased tau. So we saw a little bit about that already, with Dr. Gupta. But then, now they're telling us that, this we're seeing with these brains at autopsy, but we're also seeing this in Parkinson's patients at autopsy that never took a hit to their head. Okay, so now we have a lot more information out there, and now we're not too sure, which way to go on this. Is it everybody who takes a repeated hit to their head at autopsy, or before they get to autopsy, is going to have increased tau protein? The second impact syndrome. Okay, so again, he was talking about second impact syndrome. This is rare, but it does happen. And it usually happens in younger people. And this is what we're worried about, the talk and die, the kids that go out there, have a really bad headache, go home, go to sleep, and they don't wake up. Or they go home, go to practice the next day, and then they really have a really bad injury the next day, and they herniate, and they can really have deficits for the rest of their life. So we worry about this. And then we have really smart people sitting together in rooms like this, where we look at all this evidence and we say, okay, what does this all really mean? So we're getting a lot of information, but what does it really mean? Should we change our practice? Shouldn't we? What do we learn from all of this? So if you're really in the world of looking at concussion and assessing this, take a look at this paper that just came out in the Journal of Neurotrauma. It just came out. I had our early release, but it's out now. And it's really good because it says what these three major guidelines and position statements have in common. So what really happens, I think we really know a lot more now with some of the work done by Kevin Guskowitz and the guys in Fargo and the guys at Virginia Tech, really looking at what are the real issues and how do these things really happen before our eyes when we're watching these entertaining sports. And then the sideline evaluation and how we're supposed to be, now trying different things on the sideline. So whether it's, you're bringing them out and you're looking at their temperature, or you're looking at how many hits they've had, or you're doing, I'm going to show a test that we do now on the sidelines that looks at eye movement. We're trying to see now, what can we do acutely before these kids even have to get transported, or if they do get transported to an ER, what can we do acutely on the sideline? And so what we talk about and what we see as clinicians, parents, coaches, trainers, and this is what we're educating kids on now, and I'm going to say a little bit about educating the athlete at the end, but is the signs and symptoms. And these are really common, and they're really classical, and they seem to be the ones that are the hallmarks for this disorder. And so we have these things like post-concussion symptom checklists. We have some of these other checklists that they mentioned this morning. And then depending on what type of clinician you are, you're looking for specific things, whether you're doing a neuro exam or you're doing a balance test, or you're an athletic trainer, just asking them if they recall the last play. So these signs and symptoms seem to really be the hallmark of how we're marking this. In the conference that we were at Navis also, it was really interesting to hear some of the neuroimaging folks talking about no CT, no MRI, that's not going to show us anything, but some of these newer things that they're looking at, which is the DTI, the fMRIs, the PET scans, and again, we're starting to do these things. Is this the way to really look at these injuries? I'm not sure. I think, you have to wait at least another couple of years to really see if this is going to help prognosticate or improve treatment. And then the helmet. Okay, so we talked about helmets today. We've talked about acceleration, deceleration. There is no helmet that's going to prevent you from having a concussion. Now, the experts say that maybe a skull fracture, but not having that movement of acceleration, deceleration. So when I talk to parents, and I would talk to trainers, and I talk to coaches, I say to them, they have to wear a helmet, they have to be updated, and they have to be properly fitted. I don't care what sport this is, okay? So that's the ground rules. But I always say to them, because every week I get another email about somebody having a new band for this, or like a new cushion for that. And the whole thing is, until this stuff's evaluated, please don't tell parents to buy this stuff. So concussion-proof helmets, maybe in our lifetime, but we're not there yet. Okay, the law. So now, what also gets us a little nervous, if you're on the sideline and you're taking care of these kids and you're supposed to be making these decisions about pulling them out of play, is the law. So, of course, in 2009, we know that in Washington State, Zach Lystat took a hit, and he went back to play, didn't tell anybody, and he took a devastating hit. And he had some really smart people around him, and they said, we need to do something about this. 48 states now have concussion legislation. We did it twice, we got it the second time, and so we stayed really vague here, where we knew we could just get something passed if we said that the kids could be cleared by a medical professional. And then in small print somewhere, it says DO or MD. But this took us 2 years to do. And basically what's really good about it is that the parents have to be informed, and the coaches and trainers, about the risk of concussion, the removal of play of the athlete immediately, player practice, so they're out, no question, helmet taken, and that they have to be cleared by somebody as far as a medical professional, and in our world, DO or an MD, to go back to play. So we were really lucky because we had the governor come down and sign the bill for us, because the young man standing to his left there is David Goldstein. He goes to a private high school in Miami-Dade County, and he was very, I guess he sort of really led the charge to get this bill passed, because he had multiple concussions, was pulled out of soccer, and not until we sort of evaluated him and made a treatment plan for him with impact testing and some other things that we put in place for concussion management, which I'm going to talk to you about our program. Dave had decided that not only should his high school have this, but the whole county of Miami-Dade County. So they pay for a concussion management program for the 36 public high schools in Dade County. And I'll tell you a little bit more about that. It's not me, it's not you, it's not the coach, it's not the trainer, it's not the athlete. It's a team approach. Everybody has to play a part in this if this is going to get done right. And so what we've decided to do, and I've looked at all the evaluation tools, and I still feel, and there's some different opinions about this now, but I still feel, and I don't get paid by Impact, I'm not a provider of their talks or anything like that, is that I still feel Impact is probably the best tool we have, an objective measure for kids over 14, that we can do a baseline test and then retest after they've had a concussion. And they've got a lot of years of evaluation, and until something comes out better, I'll still be an Impact fan, and our program will continue to use Impact. So what we decided to do was, again, I can't do this myself, I had to sit down with a lot of stakeholders at the school board and say, what do you want to do with your kids? Do you want to do the right thing, or are we going to go business as usual? And they all looked at me and they said, no, we're ready. We're going to do the right thing. We got the money. The Ransom Everglades and the Goldsteins are going to fund this for the county, and they're going to do it for many years. Let's do it the right way. So we put a whole bunch of stakeholders together. We had everybody's buy-in. We trained all the athletic trainers at those 36 high schools. Now let me say something. They're the gatekeepers. These are trained, certified athletic trainers. We're lucky, because Miami-Dade County has an athletic trainer at every high school. And I know across the country, this is not the case. Very lucky that we have these people all working at the school board. There's no conflict of interest, because in other counties, some of these trainers work for rehab centers, they work for physicians, they work for, other programs. And so the thing is that you have to have a gatekeeper. So whoever your gatekeeper is, these people have to be trained properly. And then there has to be a system of training, baseline testing, a protocol, and then an evaluation of all of this, so you know that these programs are efficacious. So, of course, Miami, they love to put their name on things. So the Miami concussion model was born, and so really, I do a lot of injury prevention work. I've got a walk safe program, we've got a bike safe program. These are all evidence-based programs that I've been working on for the last 12 years with wonderful people, again, multiple agencies, and you can find these programs online, but we've been able to decrease the number of kids that have been hit by cars in Miami-Dade County since 2001 by 68%. And we are one of the highest risk counties for kids 5 to 14 years old. So I think TPAS, if you're in the room, I think he was trying to get things going here, and I think we had some schools on board. So the E models are the real, sort of bread and butter when you do an injury prevention program. This is a WHO model, and it's usually a 5E, a 4E, or a 3E. But, the problem with all these models is you have to evaluate what you're doing, because then you have no evidence and you don't know if it's really working. So it's not a fancy t-shirt, it's not a good hat, it's not a sticker, but, these programs have to be evaluated. That's why you need people and money. So what do we do? Okay, so we got the King-Devick. This is the sideline evaluation. It's a numbers test that looks at eye movement, which now they feel with 27 studies that may be a good indicator of some sort of altered consciousness, mental fogginess, cognitive impairment. And so we're using this now. I just trained 10 high schools to do this out of the 36. We're piloting this now. Arcane's already have it. They had it last year. And then we have the impact test as the baseline. And then if the kid has more severe problems when they come to clinic, I have the pediatric test of brain injury, which is a 30-minute neurocognitive screening, which we also go to before we go to a full neuropsych battery, which we do with kids that have more chronic neurocognitive issues. So again, I work with a neurologist in the clinic, Dr. Ned, and he's really big on pharmacology or looking further into any neuroimaging issues if he feels that these kids are having chronic problems. They're coming back week after week, still complaining of issues. And then the other thing is we do the gradual return to play. So this is really what we decided to do because we saw so many kids that we would clear. Okay, you've been asymptomatic for 7 days. You said you're feeling good, you're looking good, your baseline's back to normal. Okay, you're cleared, go back to contact tomorrow. These kids were coming back to the clinic. They were coming back with headaches, some vestibular problems. So we decided, you know what, let's do the gradual return to play and let's see if that changes. And now with these kids that are cleared for like the 3 to 4 gradual return, we're not seeing as many come back with symptoms. So this seems to be working, and this works well with the trainer too, because they can start low exertion to high exertion over 3-4 days, and if the kid looks good, they go back to contact. And now this is the new thing, return to learn, return to school. This is a huge problem because we don't really know still a lot about this, but what kind of accommodations should we really give these kids? Stop texting, stop the video games, stop the driving, until your headaches have gone away, you're having trouble focusing, paying attention, don't take any tests that week. So I think there's a group in Ohio that's really taking a look now at what would be good evidence-based accommodations, and could these be standardized? So could Johnny get the same accommodations because he's having headache and dizzy that Susie does because she had this injury from playing soccer? So I think the jury's still out on this, but I think people who run clinics have an idea that some of these kids do need some sort of accommodation, keeping them out of school, and I still think this is coming from our gut and from our experience, if you really want to know the truth about that. And so we also mandated a injury surveillance system. So because this is all centralized, we have buy-in from the superintendent and the athletic director, we were able to start a mandatory injury surveillance system for concussion. So even though these kids may not come to our clinic, the athletic trainer at that school has to fill out an injury surveillance form on the return to play or when that kid goes back to contact. So now we're starting to find out what the real N is for our 36 high schools in Dade County and just starting to look at this data. The last piece I want to talk about is education, because all of the programs that we develop have an educational curriculum-based program where we've evaluated the education. So what we did was we talked to the SLI people, and that's what Dr. Gupta was talking about too. Those are the CTE. Part of that is Chris Nowinski and Bob Cantu, who's a neurosurgeon, has also instituted an educational component called SLICE. And so now there's different SLICE chapters that are through the country. Chicago's doing a really bang-up job, and we just tried to do the program in about 10 high schools. And what I did was I hired an ex-NFL football player. He played for the Patriots, I know, not the Dolphins. And he goes out now and he educates these kids. So these are inner city kids, these are, mixed bag kids, these are kids that all over Dade County at all these different schools. And for him to stand up and go through a 30-minute interactive presentation compared to me standing up in front of these kids, I'm getting rave reviews from the kids and from the trainers. So it's the education piece of everybody, and then, like I said, we're using the SLI, and we're evaluating this, also pre and post testing for SLICE. And then also, there's the information that's coming out from the NFL, the NCAA, the CDC has now the Heads Up program, and there's different programs that trainers can take, coaches can take. If they're high school coaches, Pop Warner coaches, American youth football coaches. So there's things available now that are out there that can really help elevate the education levels of some of these frontline people. And even in schools, like the ABCs and the signs and symptoms, I think the education and awareness. So really, the experience I've had, and this is really on a more personal note, is that I am very fortunate to be working in a place where they've allowed me to do a lot of things and pull people together and integrate systems and look at holes to find out like where we can best decrease injury in our community. And so I can't do it alone, and I have there's the football guy there, and she's a Ph.D. neuroscience student, and the other guy on the other side, a lot of you know, is Kester, the neurologist. And so we've really been able to be proactive, take this program from 1995, which was probably one of the first concussion programs in the country, where we had it at Jackson Memorial, and now we've moved it across the street for the last 5 years to sports medicine over at UMH. So we're able to treat more patients at all different levels. And we're trying to collect data, and I'm trying to get out there and evaluate what we're doing so I can share that with colleagues like you. And I guess really, where are we going? And like, what have we done, and where do we need to go with this? And I found this quote, Winston Churchill, from this paper that just came out on protecting the brain in sports. This is not the end, it's not even the beginning of the end, but it may perhaps be the end of the beginning. And really, we have a lot of work to do. We're just at the beginning of all of this. We're just at the tip. And everybody and all the different components are going to work, I know, feverishly over the next 5, 10, 15 years. And maybe we will be able to make the sport safer. Maybe our numbers will significantly come down. But I think the education, the awareness, everybody playing their role, it's a team approach here, I think is sort of the way to go right now. So those are the remarks I wanted to make today to all of you. And I don't know if we have 2 minutes or 3 minutes for questions. That's up to you. I think we started a little late. Okay, so if there's anybody that would like to carry on the discussion, has a question, I'd love to like open it up. Anybody? Okay, well, oh yeah, go ahead.
What are your guidelines about cognitive rest once these kids go back and not watching video games? And what has been your experience with that, and what are your thoughts about it scientifically?
Okay, so I've looked at, there's not a lot of research out there, and there's not a lot of evidence about cognitive rest. There's some good work by Sandy Chapman in Dallas. They call it they have a cognitive rest period where they've looked at some studies of different age kids, but these kids had more severe injuries. And then we've looked at some of the animal literature, because I'm at the Miami Project. And basically what we've done is, through experience, I have a page of accommodations. And depending on the list of symptoms that we get and how high the symptom scores are on these kids and where they're having their issues, if they're complaining that they're having trouble focusing, they're having trouble reading, okay, that's like a red flag right there. This kid should not be taking tests, doing homework regularly, having regular classwork, home assignments. So I think that all has to be brought down. And so what we do is we take them out of that completely for a week. Then what's nice about the clinic is that we can see these kids every week. And we have Tuesdays and Thursdays, so sometimes I'll see them even like within 10 days. But basically, like, we can regulate the accommodations depending on what their post-concussive complaints are. And I really think to put a kid in a busy classroom, in a busy school, especially these high schools where people are all rushing around, it's too much stimulation for these kids. And so I think you really have to like shut them down. But the other thing is, you know, like, somebody else will tell you in the table sitting over here, is that you don't want to take them out of their regular routine either, because you still want them to have that socialization, and you don't want them to do the downward spiral with the depression and they're not part of the team and they're not going to practice. So it's a fine balance. But I'm waiting to see if this study that they're doing in Dallas is going to come out with better guidelines. But we don't have them right now. Anything else? Yeah. Hi, Phil.
Since the law came out, the difficulty that we're having is how to deal with the number of kids that are now mandated to see a medical professional. And there are only a few of you experts in a highly specialized clinic. So how do you deal with all the rest of the kids? What's your approach?
Okay, so in Miami-Dade County area, we used to have maybe 2 providers. And now, since this whole legislation and concussion craze has come up, there are some corner concussion experts now. Corner people that have put up their banner and said, we're concussion experts, we're doing impact testing, and you can come and see us. And so, these are physicians, and they're going to these clinics. So I know for sure that if you go to the Impact website, their number of people and providers has like 6 times since last year. Okay, so you're getting more providers out there. But some of these rural areas, it's an issue, because the thing now is that everybody's under the microscope. And now the trainers and coaches have been told through the Florida High School Association that they have to have training and these kids have to be cleared. And so this is a huge issue. And I'm not going to solve it. And I'm not going to solve the issue either of evaluating the legislation. Because like I tell my doctoral students, that's a full-time career. Like, you want a career? Go start evaluating the Florida legislation and see if we can even get a handle of the N from, our medical record data even, of like how many kids we're even seeing in these clinics or whatever we're seeing. So that's a huge issue. And we probably should go back to the task force group of some of us and maybe think about how we can handle that issue. Because you're right, I'm in Miami-Dade County. We have a lot of providers there.
There's the guidelines around, but one is there's that whole apprehension for the primary care people to embrace the guidelines and implement them. They're just not comfortable doing that.
Right.
So I think there's a gap of education that needs to happen.
And those are the associations. Like, I've been to some meetings now, and I think I was talking to you, that the ER docs are starting to hear a lot about this. They're sending the kids back to their primary care or their pediatrician, but these guys don't, want to do it because, for one reason or another, they're not comfortable or whatever. And we get a lot of kids that are sent from their pediatrician to our clinic because they don't want to deal with it. So I think, the associations have to get more involved, I think, in all the different specialties. And I think we could probably bring back some of us on our task force, the concussion task force. And if you want to start the ball rolling, I'm happy to chime in and get some other people around the state that would be interested in figuring out, okay, what are we going to do? Good question. Thank you. Thanks a lot. I'll be here.